This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
Well, good evening. Can everybody hear me okay? All right. Well, my name's John Norbury, and I'm the program director for the Texas Tech PM&R Residency Program, and just delighted to share with you what we're doing out here in Lubbock, Texas. Here's the basics. We launched the residency in July of this year after getting full accreditation with commendation and no citations from the ACGME in September of 2022. I'm told that's like getting a gold star from the ACGME. Our first two first-year residents and second-year residents started 6 weeks ago. We're based in Lubbock, which is a college town of 250,000 that is super affordable and very easy to get around. I tend to get upset when it takes me more than 12 minutes to go somewhere. And what we're trying to do here is create a pipeline of physiatrists to meet the need of the full spectrum of persons with disabilities in underserved areas of West Texas and beyond. There aren't many programs in this part of the country, and as a consequence, people with disabilities often need to travel a long way to get care. And that's what we're trying to address with this program. Lubbock, people never leave. It's just a really, really great place. Sometimes folks will try and leave Lubbock and then they'll come right back. Sports are a really big deal for folks here. You can catch the 5 a.m. plane out of the airport, and it's real easy to get through security, parking's cheap, and you can have lunch anywhere in the country, which was something that I really enjoy. There's great golf and disc golf, lakes that you can hang out at. The mountains of New Mexico are 3 hours away. And we are closer to the #1 UFO crash site than any other PM&R program in the country. Here's our training sites. I think to me, it's a strength of the program that we have many wonderful hospital partners. And so you get to learn different ways of doing things. Trust Point is our primary training site. And this is a picture from 2 weeks ago of me getting dunked, because Trust Point is top 10% in patient satisfaction nationally among inpatient rehab facilities. And so they dunked all the leadership to celebrate that at the picnic. Here's the structure for the intern year. This is one of our residents in the middle there during her surgery rotation. And we're really doing this in such a way to give you a nice broad-based background so that you're ready to do rehab for all these patients after they progress from the hospital. And look how happy the surgeons are in that picture. It just makes my heart warm. Here's the structure for the second through the fourth year. We have blocks. I think it's kind of, more common for programs to load up the inpatient early in the program and then have the fourth year be mostly outpatient. And we're not doing that. What we're doing is much more of an interleaving approach where inpatient and outpatient are consistent throughout the entire program. And I think that that does, it's not for everybody, but I think it does lead to better retention when you keep getting hit with things through paced repetition. And so that's what we're doing. Our curriculum is on Thursday mornings where the lecture time is protected and we have coffee for you. We have 2 hours of weekly core topics, brain injury, pediatrics, amputee on an 18-month cycle. So you get to delve into each part of rehab in depth twice during the residency. And then we have some weekly longitudinal topics. I'd like to think that we're going to have folks graduate this program who are really good at working in hospital systems, improving quality, being leaders. And so we have a 1 hour a month just devoted to that science, led by a real expert in the field. We also have longitudinal topics on wellness and resilience, health disparities and ethics and research. For the 3rd and 4th year, we have a weekly EMG and ultrasound thread. And then we have sports and pain medicine fellowships here. And those fellowship directors have been kind enough to allow our 3rd and 4th year residents join in those didactics. Finally, we have our PGY2s participating in the 1st year anatomy course with the medical students, so that you can really revisit that anatomy as you're doing EMGs and applying it as a rehab physician. And this is, I think, one of the really strong things about the program is that I've been running stuff for 2 years, before the residency started. And so we just have a culture where the faculty can run their services. And I think that allows residents to be able to do the education and take vacation and do other good things without having to worry about who's going to do the clinical work, because the program is not dependent on resident labor. Here's our continuity clinic at Veterans Affairs. Hopefully you can see that that's a pretty fun time there. And we have our 2 residents there on the left behind me with the EMG machine. And I think in the continuity clinic, in the first 6 weeks of residency, they've met like all of the ultrasound requirements and all of the peripheral injection requirements for the entire residency in like the first 6 weeks. And so I think that's a really exciting space. It's very collaborative. We work with the physical therapists. I think we diagnosed a tensor fasciolata tendinopathy last week. This week we did post-COVID rehabilitation, long COVID rehab with lifestyle medicine. We have battlefield acupuncture. It's just a delightful piece of the residency. Here's all the salary, benefits, vacation. It's all available online at the GME office. The 2 things that I would point to is that the salary to cost of living is very favorable. Salary is on par for graduate medical education, and West Texas is a significantly cheaper place to live than other places. And then for residents who are doing a good job with their medical knowledge, patient care, performing well in the residency, we will be allowing moonlighting during the 3rd and 4th years as well. Medical records, Epic, WellSky, Cerner, and CPRS at the VA. So this is not a great residency program for people who tend to forget their passwords. Call will be no more than the 4th weekend at home, or 4th weekend home call, and no more than 4 times per weekday home call. We also have 3 months of elective or selective time built into the curriculum. And so I'd like to think that we're going to have a lot of opportunities for y'all to kind of design your educational experience and lean into the areas that are most exciting for you. So don't take my word for it. Here's what some of our residents are saying about the residency program. And I don't like it when people read slides, so I'm just going to go ahead and put these up here and you can read them for yourself. I think that, one of the things that I found coming to West Texas 2 years ago is they're just the best people here, just really great, kind, salt of the earth people. And I think when you look at our interns who are on some pretty challenging rotations, I think you can see some of that West Texas hospitality coming through. We have some different personalities among our faculty, and I think that the initial feedback is that that's a really positive thing for the residents. And then here you can see a little bit of our culture on this first bullet here. Again, the faculty kind of do things on their own, so we know how to be efficient. We use the technology, so we're not documenting all the time, and that has had a really positive effect on the resident service to education ratio. I like that quote that we work hard, take pride in our work, and we have fun while doing it. You know, we take our work very seriously. I think you can see we don't take ourselves too seriously. And the shock and awe from our first grand rounds was unforgettable. Take that as you will. That can be a story that you can ask our residents should you ever have an opportunity to chat with them. So that's my whirlwind tour of what we are doing out here in West Texas, and I really appreciate y'all giving me a chance to chat about it. I just want to see real quickly if any of our residents are on the line here, just in case they want to add something to what I said there. But I don't see anyone. Oh, Dr. Neighbors, if you want to go ahead and unmute yourself and just chat a little bit about it from the resident perspective, I think that would be great before we go into the Q&A.
Okay. Hi, my name's Lexi. I'm one of the PGY2s. I think Dr. Norbury always does a really good job of like hitting on how special it is to have this program out here in West Texas and be able to really kind of integrate ourselves into the community and be able to provide this service for these people that have gone so long without the kind of care that they've really needed and have had to go hours and hours away just to get appropriate medical care. I think that's a huge benefit to this program. I think additionally, like apart from just kind of, you know, that aspect of everything, like I have like just really appreciated like all of the support and like how much our attendings here like actually really care about our education, but also our wellness. But yeah, it's I don't want to take a whole lot of time because I think I could ramble on and on about being here in West Texas and being affiliated with Texas Tech. But if anyone here has any questions or like wants to talk any further about it, you can always reach out to me. Okay.
Outstanding. I'm looking at the chat here. I assume this is a question for us. Are you having a virtual open house? If so, when? And so what we would do is we would welcome your application to the program. After we make our choices in terms of who we will interview, we typically have an open house before the interview week, and folks can learn a little bit more at that time. Good question from student Dr. Yadav. You know, should DO applicants have USMLE and complex board exams, or is complex enough? You know, y'all get enough debt. And so I think we are good enough at reviewing applications that we can discern who's a good fit with our culture. And we have very, very strong residents who did not do USMLE and who did complex and value their participation in our program. Student Dr. Gall is asking about sports coverage and athletic teams and events in Lubbock. And I don't see that would be a problem. We have an excellent relationship with sports medicine. I know they do that coverage, and I think that would be fine. We do not host international, well, historically, we have not hosted international medical graduates for rotation. It's not that we don't want to do that. It's just that we don't have the bandwidth to accommodate those learners at this time. Do we prefer Texas natives residents? And so I think that there's a huge part of the country that needs PM&R docs. I think a lot of the programs are on the East Coast, West Coast, urban areas. And so I would say that we probably do look for people who would be a good fit with Lubbock and the culture and might want to like serve those areas in the Mountain West and Southwest. They're a little bit out of the way in Texas. And so I don't think that just specifically being from Texas would give you preference, but I think there is a geographical underserved area, and if that aligns with where you want to practice, that would be something that would work well for us in choosing applicants. Any expands on expanding to El Paso? Well, gosh, we just got things up and running in Lubbock about 6 weeks ago, so I think we want to catch our breath and go from there. But I think that is something in terms of a 10-15-year plan would be folks like Dr. Neighbors from Midland, Odessa, Amarillo, El Paso. I think they have the same problem. And I think we would be very, very successful if we were to help grow PM&R in those areas as we go. Opportunities for community involvement. So we're pretty darn passionate about that. So one of our faculty will round on a ridiculous number of patients in the morning and then go build a ramp for somebody with a disability in the afternoon because she's a boss. So I think that that's something that we do. Another one of our faculty will take people with spinal cord injuries out on his boat in the lake to go fishing. And I really want, as we grow, for us to partner with medical students like y'all who are excited about rehab, to really be champions for this population, helping people with brain injuries, pediatric disability, spinal cord injuries to thrive and flourish. And to us, that's not something that only happens in hospitals and clinics.
4 minutes left.
Didactics available virtually for applicants and medical students to attend. Boy, what a great question. I haven't thought of that before. Let me get back to y'all on that. I'm a bit of an extrovert, so I love things being in person. And so what I tell people is if you want to be in your pajamas and have Zoom lectures, this is the wrong program. But I hadn't thought about how, if we had the reverse happen where people could Zoom in, how that might add. So I'm gonna have to think about that a little bit. Is just 2 per year, do you see that changing? The way residency accreditation works is you get initial accreditation, and then the residency review committee comes to check on you and make sure you're doing everything right. And then you are kind of good after that. And so I was thinking that we'll go for these 2 years, make sure everything's good. And then I do think, for the reasons Dr. Neighbors pointed out, there probably is a need for more than 2 per year. And certainly there's more interest among medical students than there is capacity. So who knows until it changes. We don't know that it would be for sure, but I think that in our vision would be growth in line with our vision.
2 more minutes. Are there any last questions? Oh, Lexi, do you have something to say?
Yeah. So I think another one of our community involvement opportunities that's relatively new because of our pediatric physiatrist that we have now, she actually introduced like our ability to participate in this, what is it called, Dr. Norberry, cheer abilities.
Oh gosh, there's so many ideas.
Yeah,
I'm still getting over the rodeo for differently abled children. But yes, cheerleading, equine. She has all kinds of ideas.
There's a lot of opportunity.
And when she starts talking about improving the lives of children with disabilities, she makes me seem kind of low energy. So I see some growth in that area. Well, thank you so much. Follow us on social media. We're having a great time out here in West Texas. And thank you so much for your interest, and best of luck with your career growth.
Thank you so much for being here with us tonight. Really exciting program. Really looking forward to seeing where this goes.